scratchy throat? Is it a sore throat? Is it nasal congestion? Maybe a cough? I mean, runny nose. What are we talking about when we're talking about Omicron? Guys, I'm Dr. Jen Caudle. We're going to talk about the symptoms of Omicron, and more importantly, I'm going to tell you right up front what I want you to understand from this video and what I think is so important. With this variant in particular, we need to be hyper vigilant about any symptoms that we have. And I don't want you to drive yourself crazy, but what it means is don't blow things off, because we are finding this variant to be just a little bit different than some of the variants we've had in the past. Yes, there has been data that suggests that it's milder, but not all data has conformed to that thought. And yes, there have been studies and many people and patients even that say that the symptoms are milder, but I want to remind us that Omicron is not necessarily going to be mild in everyone. So what are the symptoms, right? What is it that you should be looking at? Well, classic symptoms that have been reported on are things like, I'm looking at my list, scratchy throat, sore throat, nasal congestion, dry cough, muscle pains, low back pains, things like that. But I want to caution you and me as a family doctor to not sort of hang our hat only on those symptoms. It's important not to get into a box, or rather look at an Omicron box and say, oh, well, the symptom I have doesn't fit into that box, therefore I don't have it. If you're feeling unwell or you feel different than you normally do in terms of not feeling well, sick, under the weather, no matter kind of how it is, getting a COVID test should be top on your list. Remember, it is possible for people to have nausea, vomiting, diarrhea, or have symptoms that feel like allergy symptoms. Don't necessarily blow off allergy symptoms to assume that they are just allergies, because they may not be, not in this particular climate. Also, gastrointestinal symptoms, GI symptoms may not necessarily be just a stomach bug. It's possible it could be COVID. It's important to keep in mind that COVID can present itself in different ways. So I'm going to ask you all, just like I ask my patients, to not get too confined to a certain box, assuming that if your symptoms fall within this realm, it must be Omicron, and if it doesn't, it's not. Not necessarily. Go ahead and get tested if you are concerned at all, if you have any symptoms that are unusual, or you're feeling sick or under the weather. And while you're waiting for a COVID test, while you're waiting to get tested, whether you're going to get tested or you're going to do the test at home, when you start not feeling well, you need to start isolating as well. You need to call your close contacts. You need to isolate. If you have any questions about your further actions and what to do, or if you're feeling really, really ill, you need to call your doctor or go to the emergency room. But once you think you are not feeling well, isolate and make sure you get tested. Guys, that's the most important thing. I think we're going to learn more and more about Omicron as well as other variants as time goes on. These are the symptoms that we're hearing about now, but I like to remind us to never say never, that things can change and not everybody is created exactly the same way. So your symptoms may be different than someone else's. You may end up with Omicron and not have the classic symptoms that everybody's been saying you have with Omicron. And remember, there may be differences between those who are vaccinated and unvaccinated. Once again, getting vaccinated is the most important thing you can do. Guys, I hope this is helpful. If you've had COVID or if you haven't, let us know what your symptoms are in the comments. Also let us know if you thought you had allergies or something else and it ended up being COVID. Hopefully your input will help other people. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. For those of you who have not liked and followed my page, I invite you to do so. For those of you who send stars, I thank you so much. And for those of you on YouTube, thank you so much for watching this video. Please subscribe to my channel and click the little bell for updates. Guys, I'm Dr. Jen. I'll see you soon.